everyone. Thank you so much for joining us in today's episode of BioWiz podcast, Meet the Weezard. I am Elizabeth and I am happy to be here today with Santiago Ini. Hi, Santiago. How are you?
Hi, Elizabeth. Nice to be here. Thank you very much for the invitation.
Thank you for being here with us. Santiago, you are an entrepreneur and an expert in innovation and technology transfer. So could you take us back and tell us a bit more about your journey and what led you to where you are today?
Yeah, sure. Everything started a long, long time ago when I was a kid. I was some kind of a dreamer. A dreamer believe, that nothing is impossible, like every kid. Later on, I finished my military service in Argentina, and as an entrepreneur and idealist, I just make Aliyah, came to Israel, start my life again. Let's say, same start from zero. What indeed is what the entrepreneur do in life: start something from zero, from scratch, to build something. This is what I did. I started here in Israel my studies. I did my PhD in chemistry in the Technion. Then I continued, did a postdoc, did an MBA, and all the time continuing my studies, and then start working in Israel in the industry. I work in the pharmaceutical industry, moved to the nutraceuticals, and moved to the tech transfer office of the Technion later on. And this journey make me, to build some abilities in different areas, know different areas in the life science. And here I am.
Okay, so let's understand a bit more about the services that you provide. You are an expert in innovation, technology transfer, and you are working in life sciences business development. So could you tell us a bit more, describe a bit more your services?
Yeah, of course. Everything, innovation is a big, big word, and tech transfer also. Everything is a matter of the right combination. How to bring innovation, how to bring an idea to a fact. What you need to do that, how to do that, and more important is why. Why? And let's start from the last one. Is why is to find the need. What is the need in the, can be society, can be science, can be technology, can be to get to reach to the moon. What is the real need, and how to take the tools, the existing tools can be, look out of the box and sometimes into the box. People doesn't understand, but sometimes you have all the tools around to you and build this innovation, not build, transform it, the innovation into a process. Essentially, in the innovation side, this is what I am doing: is taking ideas and developing to a product. Can be from, for example, from an algae, to bring the idea or the theory and into a product, as I did in the past. Or today is how to introduce the cannabidiol, which is a compound that is very interesting molecule that is not psychoactive, into the market, where the people, just only listen the word can, and think that they are looking on something bad. There is bad idea, bad connotation. So it's include a lot of things, including the build, including teach, including to work together.
You are also working in the private sector, but also on the academic world. Could you describe for us the difference of the dynamics between those two words?
Yes, yes. And this is my role in the tech transfer office in the Technion, for example,
Mm-hmm.
is to build the connection. Sometimes people think that the technologies only go from one side to another, and this is not absolutely true. The dynamic is connected in both directions. I mean, there is need from the industry that you can transfer to the academy, and then the role in the tech transfer office is to find this connection, find this need, or address essentially more true, is address the need from the industry in the academy.
Mm-hmm.
Who can solve the problem? Who can help to solve the problem?
Mm-hmm.
Sometimes, for example, I found people, the scientists that have technology that they believe that can be used for humans for treat X disease. In the other hand, the same technology can be used or can address the need of agriculture
Mm-hmm.
to treat, infections or treat plants, etc. And it is very important point because you see all the picture. So you see the needs, you see what innovation can do, what invention can do, and then you have to connect it. You have to do the integration of this, and this is amazing. This is amazing because it's something that they can start in a point and can go in different directions, depend of you, depend of the other side, the industry, and depend of the academy. What is interesting in Israel that the government understand this, and there is a model, the triple model that you have in one side the industry, the other the government with Israeli Innovation Authority
Mm-hmm.
and academy.
Mm-hmm.
So the government incentive first, also the academy as well the industry with different programs, as well they work together. For example, to take technology from the research to the development.
Do you observe any trends, any changes that are happening all over the world in that regard when it comes to projects being more transversal and industries working more together?
Yeah, first of all, I see that in different places, people are in different countries are understanding this,
Mm-hmm.
understanding that if you take alone the industry or if you take alone the academy, it doesn't have the same synergistic result that taking both together.
Mm-hmm.
Because in the moment that you take both together, each of them complement the second one and build something bigger. And this is the first. The second is the multidisciplinary area that is very important. You see today, for example, in a medical device startup, you can see a team that is built by, for example, a mechanical engineering, a medical doctor, and a biologist or a chemist, for example. Three different disciplines that can make together. You see, for example, different faculties in the academy, for example, that they are multidisciplinary. Example is, for example, biomedicine. Biomedicine is a new multidisciplinary area. Some people say that also biotechnology and food engineering is also multidisciplinary. And the third is the digital transformation. Digital transformation make a big, huge change because it's taking all what you have and integrating into the digital world. And this is something that is not simple, but people are doing very, very well, but it require a team, a multidisciplinary team. In the moment that you understand that you need a multidisciplinary team, that you need contribution from different sides, you are on the right way.
How do you explain this new trend in light of the society new dynamics, the change in the society, in the demand itself that require projects, life sciences project to become more transversal and multidisciplinary?
Okay, it's a very interesting point because I have two answers. One is social, and the second is technology. Look, I give you an example. 100 years ago, in some time in some countries, people think or government thinks that to be angry and the poverty is something that it should be normal. That we have to live with this.
Mhm.
And there are some and there is some change there that people understand that the economy, the capitalism, you name it, whatever, require a contribution of all the parts. Is in the moment that you don't have that you have people in poverty without education, you are losing working place, you are losing need, and you are losing a lot of the resource. The moment that you give education and you give work and you give tools, then you generate also an innovative economy. You generate also need, you generate money. So it's something that came together. People also say that there is a social impact in in this transformation, in this entrepreneurship, and it's creating, more tools, educating people. You are creating also an economy. You are building an economy. And this is something that, 1 or 200 years ago, is something that it doesn't was clear. People saw the didn't see it, but today see it more, more, and more. So this is a why from the social point of view. Now, from the technology point of view, every time you want more. You first you build, you start with the computer, then you go to the laptop, then you go with the telephone, with the smartphone, then you go to the tablet. There is a need on the people that everything wants more and more. Maybe it's, I don't know, maybe it's the nature of the human, but this technology build a need to have more and give you a why from the technology point of view.
Yes, I think it's the more, but also the better. Somehow, this trend of going multidisciplinary is also including more and more elements of the world we are living in, and create more value, as you said.
You have too many solutions that you don't have to where to implement. In the moment that you have too many things, you have to find problems, and there is a lot of problems in the world. And for example, let's take life science, let's take diagnostic kits, tools, or medical device. They can bring solutions to different problems there. They can integrate between what they have to what they need. An example is all the tools that they are building based on the smartphone, for example.
Mhm.
Ultrasound is very well known for a lot of years, but the combination of the smartphone with the ultrasound is something new. And this is a multidisciplinary result. This is one example that we learn, that, for example, the corona was one of the catalysts
Mhm.
on this. The moment that the people doesn't, can go out, and the doctors prefer to not have too many people on the same time for avoid the infections. You have to build tools that can help you to handle this. And
Yes.
for example, the ultrasound online is an example. Oh, let's take, for example, the watch, the smartwatch, that can measure you the heartbeat, can measure the blood pressure, etc. It's something that is again, the blood pressure you can measure without the phone and without the watch, just with a simple machine that doesn't need batteries. And in the moment that you can build, for example, a watch that can do all these activities, do you
Mhm.
really need this? Well, I don't know if you really need. You can have your system and measure it in house. But in the moment that you have in the watch, it can, first of all, it's nice to have. Second, it can help you because some people, have a blood pressure, doesn't feel good, and then can, anywhere they are, they can measure the blood pressure.
Yeah. You were talking earlier about the whole fact that entrepreneur startups have this desire to actually change things. And this also explained this whole new trend of doing business, doing good, social entrepreneurship.
This is a
Um,
very interesting interaction because, again, this is something that start, with the target was the social. was a social change. It was to do something good. And today we see more and more companies that start from the social impact and move to the business. For example, I can give you one company in Israel that started developing for help kids with ADHD instead of take Ritalin or any other drug, is to use neurofeedback, and they start,
Neurofeedback.
helping, and then they move and build a prototype, and then they build a startup, and they produce today a system for if neurofeedback. Start with the social and move to the business.
Of course.
In the same situation, you have another place of the world, companies that, first start is helping people with diagnostic, helping people to manage on how to use medical device. And then they, with the same people that they help them, the same people is helping them to build the new generation of products. Think about this, that at the end of the day, any product need a user. Okay. So it should be
Exactly.
together, should go together.
Of
Or
course.
the system, or the technology help the user, or the user build the technology
Exactly.
to help yourself,
Exactly.
themselves.
Thank you so much, Santiago, for being here, for sharing with us all your knowledge and your views.
A pleasure. Pleasure. Thank you very much for having me, and let's be in touch.